Surgical anatomy of the latissimus dorsi muscle. The latissimus dorsi muscle is the broadest muscle of the back. This muscle is partially covered by the trapezius muscle, as you can see here in this diagram. The latissimus dorsi muscle is a strong muscle that's helpful in performing sports such as swimming, gymnastics, and rowing. Origin. The latissimus dorsi muscle originates from the iliac crest, the thoracolumbar fascia, the inferior process of the inferior 6 thoracic vertebrae, and the inferior 3 or 4 ribs. Insertion. It inserts into the intertubercular groove at the front of the humerus. Here is the arrangement of the muscles inserted into the proximal part of the humerus. The subscapularis muscle is inserted superiorly at the lesser tuberosity. The teres major muscle had the most medial insertion. The pectoralis muscle had the most lateral insertion, and the latissimus dorsi muscle insertion is between the teres major and the pectoralis major muscles. So the latissimus dorsi muscle is inserted between two majors, the teres major and pectoralis major muscles. All the three muscles are inserted below the subscapularis muscle. The biceps tendon lies within the intertubercular groove. Function. Anatomically, the latissimus dorsi muscle is a muscle of the back. However, functionally, it is a muscle of the upper limb. So what is the function of the latissimus dorsi? The latissimus dorsi is responsible for adduction, medial rotation, and the extension of the shoulder, similar to the action of the teres major muscle. Also, the latissimus dorsi raises the body towards the arm during climbing. The pectoralis major muscle is also a synergistic muscle. Innervation. The latissimus dorsi is supplied by the cervical nerve roots of C6, C7, and C8 through the thoracodorsal nerve. The thoracodorsal nerve arises from the posterior cord of the brachial plexus between the upper and lower subscapular nerves. The latissimus dorsi muscle is used as a free flap, especially in open fractures in the distal third of the tibia. The latissimus dorsi reconstruction flap is a free tissue transfer that usually occurs within 7 days from severe trauma. In general, what is the ladder of reconstruction with increasing complexity? Primary closure, secondary closure, skin graft, local flap, regional flap, free tissue transfer. So the latissimus dorsi is the highest level of complexity in soft tissue coverage of open fractures and usually is done for grade 3B and 3C. They found that free tissue transfer within 7 days for severe trauma decreases the complication rate. Increased risk of infection beyond 7 days if the bone is not covered. The odds of infection increases 16% for each day beyond 7 days. The latissimus dorsi muscle also is important when you deal with periprosthetic humerus fracture, which will require long stem prosthesis if the implant is loose. But if the implant is stable, will require open reduction internal fixation. The open reduction internal fixation can cause iatrogenic radial nerve injury if the wires or the cables compress or pinch the radial nerve when past 4 cm distal from the inferior aspect of the latissimus dorsi insertion. And this is the area of the entrance to the spiral groove. Latissimus dorsi rupture Rupture is a cause of pain in the thrower's shoulder. The tear of the latissimus dorsi is caused by eccentric overload during follow-through of the throwing motion. Diagnosis: pain over the latissimus dorsi, which is worse with shoulder adduction and internal rotation. Local tenderness and deformity over the muscle. The rupture is rare and is a clinical diagnosis confirmed by MRI. The treatment is usually non-operative with rest and physiotherapy. Surgery can be done in competitive athletes with a complete tear, and repair is done early. If surgery is delayed, the procedure may be difficult due to retraction, scarring, and fibrosis of the muscle. In this situation, reconstruction, which is a bigger operation, may be needed to restore the function of the latissimus dorsi. What is the blood supply of the latissimus dorsi muscle? It is the thoracodorsal artery. The axillary artery gives the subscapular artery. The subscapular artery gives two branches, the circumflex scapular artery and the thoracodorsal artery. The thoracodorsal artery have two branches, the horizontal branch and the descending branch that gives three perforators. It is the thoracodorsal artery that supplies the latissimus dorsi flap. The latissimus dorsi can also be used as a tendon transfer in the treatment of massive, irreparable rotator cuff tears in the young adult patients. This transfer decreases the pain and improves function of the shoulder. The patient must have an intact subscapularis function and no shoulder arthritis. The latissimus dorsi is positioned over the top of the humeral head, covering the rotator cuff defect. It's interesting to note that the pectoralis major transfer is used for chronic subscapularis tendon rupture. Thank you very much. I hope that was helpful.